Hey there, health enthusiasts! Welcome back to our channel. Today, which is the 19th of June, which also is World Sickle Cell Day, we have an incredibly important topic to discuss: sickle cell disease. In this video, we will dive deep into understanding the causes, symptoms, and available treatment options for this condition. So, let's get started. Did you know that sickle cell disease affects millions of people worldwide? It's a genetic blood disorder that can have a significant impact on a person's life. By the end of this video, you'll have a solid understanding of what causes sickle cell disease, how it manifests in the body, and the various treatment options available. Causes of sickle cell disease. Sickle cell disease is a genetic disorder characterized by the presence of abnormal hemoglobin, the protein responsible for carrying oxygen in red blood cells. Sickle cell disease is caused by a mutation in the hemoglobin gene, resulting in the production of abnormal hemoglobin called hemoglobin S, HbS. This mutation causes red blood cells to become sickle-shaped when oxygen levels are low. The disease follows an autosomal recessive inheritance pattern, and populations with a historical prevalence of malaria, such as those of African, Mediterranean, and Indian descent, are more susceptible. Sickle-shaped red blood cells can block blood vessels, leading to symptoms, complications, and organ damage. Research continues to improve understanding and develop treatments for this genetic disorder. Children get sickle cell disease when they inherit 2 copies of the mutated gene responsible for the condition, one from each parent. Sickle cell disease follows an autosomal recessive inheritance pattern. This means that both parents must carry at least 1 copy of the mutated gene to pass it on to their child. When both parents are carriers of the sickle cell gene, each child they have together has a 25% chance of inheriting 2 copies of the mutated gene and developing sickle cell disease. Similarly, there is a 50% chance that the child will inherit 1 copy of the mutated gene, becoming a carrier, having sickle cell trait, and a 25% chance that the child will inherit 2 normal copies of the gene, having neither the disease nor the trait. It's important to note that individuals with sickle cell trait generally do not experience symptoms of sickle cell disease. However, if 2 carriers have a child together, there is a possibility that their child could inherit 2 copies of the gene and develop sickle cell disease. Genetic counseling and testing can help individuals understand their risk of passing on the disease and make informed decisions. Symptoms of sickle cell disease. Sickle cell disease, SCD, can present with a range of signs and symptoms that can vary in severity from person to person. Here are some common signs and symptoms associated with sickle cell disease. 1. Pain episodes. SCD is known for causing severe pain episodes called sickle cell crises. These episodes can be triggered by factors such as stress, dehydration, infection, or low oxygen levels. The pain can occur in various body parts, including the bones, joints, chest, and abdomen. 2. Anemia. SCD can lead to chronic anemia, where there is a shortage of healthy red blood cells to carry oxygen throughout the body. This can result in fatigue, weakness, and shortness of breath. 3. Swelling of hands and feet. SCD can cause swelling in the hands and feet, which may be a result of blocked blood flow and inflammation. 4. Frequent infections. Individuals with SCD are more prone to infections, particularly those caused by bacteria such as pneumonia. This susceptibility is due to a compromised immune system and functional asplenia, a condition in which the spleen doesn't work properly. 5. Delayed growth and development. SCD can affect growth and development in children due to the chronic anemia and reduced oxygen supply to tissues. 6. Vision problems. In some cases, SCD can cause damage to the blood vessels in the eyes, leading to vision problems. 7. Ulcers. SCD can cause painful ulcers, particularly in the legs and feet, which may be slow to heal. 8. Increased risk of complications. Individuals with SCD have an increased risk of complications such as stroke, acute chest syndrome, a condition similar to pneumonia, gallstones, and organ damage. It's important to note that the signs and symptoms of sickle cell disease can vary from person to person, and some individuals may experience milder symptoms while others may have more frequent and severe complications. Regular medical care and management are essential to minimize the impact of the disease and prevent complications. Treatment options for sickle cell disease. The management and treatment options for sickle cell disease aim to alleviate symptoms, prevent complications, and improve overall quality of life for individuals with the condition. Here are some common approaches. 1. Pain management. Sickle cell disease can cause severe pain episodes known as sickle cell crises. Pain management strategies may involve over-the-counter or prescription pain medications, heat therapy, hydration, rest, and sometimes hospitalization for more severe pain. 2. Hydroxyurea. Hydroxyurea is a medication that can help reduce the frequency and severity of pain crises in some individuals with sickle cell disease. It works by increasing the production of a type of hemoglobin that reduces the tendency of red blood cells to sickle. 3. Blood transfusions. Regular blood transfusions can help increase the number of healthy red blood cells in the body, reducing the risk of complications and improving overall well-being. Transfusions are often used in individuals with severe sickle cell disease or those at high risk of complications. 4. Oxygen therapy. Supplemental oxygen can be administered during sickle cell crises or acute chest syndrome to improve oxygen levels in the blood and relieve symptoms. 5. Medications. Various medications may be prescribed to manage complications and prevent infections. Antibiotics are commonly used to prevent and treat bacterial infections, and vaccinations are recommended to protect against specific infections, such as pneumonia and meningitis. 6. Comprehensive care. Regular follow-up visits with healthcare providers who specialize in sickle cell disease are crucial. They can monitor the condition, provide preventive care, and offer guidance on managing the disease effectively. 7. Education and support. Education and support programs are vital for individuals with sickle cell disease and their families. They provide information on managing symptoms, coping strategies, and resources for emotional and social support. 8. Gene therapy and stem cell transplantation. These are more advanced treatment options that are still being researched and developed. Gene therapy aims to correct the faulty gene responsible for sickle cell disease, while stem cell transplantation involves replacing the bone marrow with healthy stem cells from a donor. It's important to note that treatment plans are individualized based on the severity of the disease, symptoms, and overall health of the person with sickle cell disease. Consulting with healthcare professionals who specialize in the management of sickle cell disease is essential for personalized and optimal treatment. Lifestyle tips for managing sickle cell disease. Living with sickle cell disease can be challenging, but there are ways to enhance quality of life. In this section, we'll provide practical tips and strategies for managing daily life with the condition. We'll discuss the importance of a healthy diet, regular exercise, stress management techniques, and the value of a strong support network. That brings us to the end of our video on understanding sickle cell disease. We hope this comprehensive overview has provided you with valuable insights into this condition. Remember, education and awareness are crucial in supporting individuals living with sickle cell disease. If you found this video helpful, don't forget to like, share, and subscribe to our channel for more health-related content. Stay healthy, stay informed, and we'll see you in the next video.